Are you experiencing pain in the front of your shoulder in a straight line just like this? If so, you better watch this video because I'm going to explain how you can treat bicep tendonitis at home with very little equipment. So listen up. And first, before we get going, please subscribe to Riley Rehab. I'm coming up with regular content all the time. My big goal is to help you become the expert of your own body. And with that being said, we're going to get into bicep tendonitis. So for those of you who don't know, you have a bicep basically on the front of your arm. It's a muscle you use to curl things up and down. But it has two tendons that go up. One of them goes up in the inside and the other goes up on the outside. And for a lot of reasons, this one on the top can get irritated. And this is why people often feel that pain going straight down in this direction. I will say this pain is often more aggravated by movements of the shoulder rather than movements of the elbow. So often people can still do bicep curls, can still carry grocery bags, no problem. And that brings me to my next part, that I believe this is often misdiagnosed in a lot of people. One thing that many of you may not know is that your shoulder joint actually has a connection. It's kind of through the joint fluid, but it eventually goes close to where that long head of the bicep out there is. So basically, this is why many different shoulder injuries, completely unrelated to the bicep tendon, can still cause pain in this area. And I've seen this a lot clinically. I've seen a lot of people where they've dislocated their shoulder and they get pain here. They've had a frozen shoulder and they have pain there. They tore their rotator cuff. Many other things, none of which are actually a bicep problem in itself, yet they still have pain in this area. So for that reason, before getting into all these exercises, it is worth getting checked out, having somebody just to kind of give you an idea of what's going on with your shoulder, because this is one of those things that a lot of people think just because they feel it there that it's the issue, when really there's something else you need to take care of. With that being said, assuming you have bicep tendonitis, the best thing to do to work on this is to slowly load it a little more and more. So you basically gradually want to work that muscle out more and more and more until it gets strong enough that it can handle what you used to do before you got injured. So I'm going to show you a progression of exercises you can do to help strengthen this area, starting with the easiest and then getting it harder and harder. The first one is just to start with an underhand bicep curl. So with this, you just take your leg, you put your arm right here, turn your palm outwards facing forward, and then you can even lean down a little bit so your elbow is right against your knee, and then you curl the weight up, and then you bring it down like that. Making sure you go very slow on the way up, and then slow on the way down. Usual theme with rehab exercises is they should be slow and boring. They shouldn't be too jerky and crazy, because often that can set things off a little more. Now, many of you might find this really easy. You can increase the weight. However, if you are one of those people who feels you can still curl as much as you normally could, the more challenging way to do this is to actually turn your palm, hold the weight here, bring it out like this, and then do curls in this direction. And this will actually help target that long head. I actually feel it quite a bit right now when I'm doing this. I'm going to move out of the way so you can see me here. But you're basically holding it away from your body, so your elbow should be pointing that way as far as possible, and then you're curling like that. With these exercises, it's usually best to start just doing 3 sets of 10 every day, and then gradually adding on a little more if you can handle it. Now the next level is called the uppercut. Now this is even harder. So what you're going to do here is you're going to actually hold your arm mostly straight. You can keep it slightly bent. And I would try this with just the weight of your arm before adding on any weight. I'm going to turn this way so you can see you're basically lifting your arm up diagonally like this. So it's kind of like if in boxing you're throwing an uppercut, you're not keeping your arms in tight, but you're keeping them more loose. And then you lift up right there. And the whole idea with this is this will target that bicep muscle, the long head right there, because it has to pull your arm up in that direction. To make this harder, and this is something you do have to be a little careful with, but to make it harder, you can hold on to a weight and then you can bring it up like this here and then bring it down. So that's the first part of working on bicep tendonitis. The second part too, and a lot of people don't really go into this, but sometimes the tendon can actually have inflammation around it. It's called tenosynovitis for those of you who know the terms. And basically with that, the goal is to strengthen it, but you also want to try to get that moving. If you imagine, it's kind of like, it's almost like the bicep is going through the sleeve and something in the sleeve kind of sticks onto the bicep. So imagine you can't get your shirt off because it's stuck. And that's kind of what's going on with the tendon. It's stuck in there. And one way you can loosen it up is actually by doing what's called gliding the tendon. And basically what I'm doing here, I'm going to show you sitting in this direction here. Basically what you're going to do here is just start with your palm, start with your elbow facing forward, and then turn your palm down, but don't let your elbow turn in. This is a little bit complicated, so just bear with me on this, okay? You want to hold on, make sure this little pocket of your elbow turns forward, and then slowly turn your hand down, but don't twist in the shoulder. This is important because this puts the bicep on as much of a stretch as possible. If you're finding this too tricky, just go palm up. Don't worry about that turning the palm in part. Just turn it just turn your palm as far forward as possible. Now with that, what you're going to do is you're going to bring it back, keeping your body nice and tall. You're going to bring the arm back, and then bring it forward. And then bring it back, and bring it forward. With this, I'm not a huge fan of holding this as a stretch. Although it can help in many cases, I do like the idea of kind of trying to glide it back and forth. Because the whole idea with this is you're just slowly freeing it up from any kind of restrictions you might have in that area. Once again with this, start with a good 3 sets of 10. If you do want, you can definitely do up to 3 sets of 20, even 5 sets of 20. All depends on the level you're at. Of course, check with your medical provider before taking any of this advice, but if this helps, please give it a like, please subscribe to Riley Rehab, and I'll see you next time.